Monty,
in the
will you
morning.
email Peggy on that, would you please?
Yeah, you bet, Peggy.
Yeah.
And I have to excuse myself, I have a training meeting tonight too.
Thanks, John.
Any other, I thought there was another question down there, but maybe I just saw your hand going up to the camera, sorry.
Yeah, I'll make a quick comment that whole concept of patient assistance programs. What it looked like 10 years ago is very different from the last year or the last 6 months. We have, I'm a provider in other context, and I used to count on the cheaper cost of generics in order to save people from the donut hole on their Part D Medicare. I'm now shocked with how quickly people are getting to that donut hole. And some pharmacies in the state aren't tracking it, and the patients that don't have a copay for a long time don't realize it until they get the sticker shock.
Yeah.
And so an example would be a tricyclic antidepressant that was $41 a month for a person, is now $750 a month. And there were 6 manufacturers of this medicine. It's a very old medicine, over 30 years old, and now there's only 3 in the country. And so we are having some, it's a free-for-all in terms of where the costs are going to be for this medicine. So yes, there are still good patient assistance programs out there, and you can do it on a shoestring, even if you don't have a $200,000 grant. But it's still going to be a very dangerous time, I think, for our county. I consider it almost a public health crisis.
Right, when people who need to be stable can't get their medications,
Right.
it's a huge issue.
And I hope that we consider, well, I'd like to support considering that, so that we have a safety plan for that.
And I'm more than happy if you guys want us, I'm looking at you, Peg, if we want to form a community committee on that, I know Virginia would sit on that.
And I'll volunteer time.
So,
I'll be happy to do that.
and would you tell me your name?
Desidy Clark.
Oh, you're Richard's wife.
Yeah.
Oh, lovely. If you can,
And I'm a
Connect.
nursing practitioner. So.
right, if you can connect and then we can get something going, and that would be lovely.
Did any of you participate in Natalie Claiborne's Community Health Services Development Project, for a community health plan? It was specifically for the hospital, just this last summer. Kirsten, you were involved.
None of these people were on the board, but you may have gotten the survey.
The survey was sent out in March, wasn't it?
Right, yeah,
So-
spring something.
That's the one that's posted on the hospital, but it said that there was there was a significant number sent out in the community. No one here got that survey?
We got it.
Oh, you did? I mean, we're just curious, not everybody gets it, there was only about 400 surveys.
Yeah, we got it.
That identified a lot of these issues. I don't recall the patient medication one.
Mental health was on it. but
Yeah,
they talk about
certainly.
this.
Yeah.
Sure.
Another issue that I personally had, and Regina solved here a month or so ago, or 2 months ago, people here in the county have been spoiled because we will call the pharmacy in the morning at 9 o'clock and give them a prescription and expect to go in there at 4 in the afternoon and have it ready. All of a sudden that stopped.
Well, it's expired.
An expired prescription. But all of a sudden that stopped, and I have a friend just today told me it's been 4 or 5 days and he finally got it refilled today. He was a diabetic, but I don't know what's happening there, but it's causing Kurt at the pharmacy a lot of problems.
Oh, the order, you're talking about the orders.
Yes, and getting the prescription approved and back in a reasonable amount of time, because there's not too much profit in it for Kurt.
There's none for a small pharmacy. I used to run 2 of them.
Yes,
There's none.
and he's calling 2 or 3 times to get it refilled and so forth and so on.
So just so you know where we are with that, when you go to an electronic record, e-prescribing is supposed to take care of that, make that all better. In real life, what happens is it just bottlenecks in an invisible universe, right? Okay. So what we haven't done a good job at the clinic yet, but we talk about it, is we need to say, please help us, we'll help you. We need you to notify us 3 days in advance of when your script's going out, unless it's an emergency. Sometimes you don't want all of that. But we need to put, and that's standard in almost every clinic in the country.
That's right, people here are spoiled.
Right.
I mean,
Well,
yeah.
I mean,
Yeah.
trust me, I owned a pharmacy, so I wouldn't follow the rules some days, and they go, oh, she's the boss, I better, I try not to do that. But we need to put those kind of standards in place so that the pharmacist has some leeway. It gives us a buffer, and that we don't strand people without their critical meds for stabilization, especially diabetes.
Yes.
I'm frightened by that. So this is a project, Regina, we took on week 1.
Yeah.
Okay? We're not solving it yet. Remember, it's a problem at every single clinic in the world. Ours, the good news is, it's so bad that we're going to make progress leaps and bounds. But we will make progress,
Yeah.
and it is a critical, right? I'm not going to go unless you fill my prescription when I need it. I just am not.
Yeah.
I wouldn't go to this clinic unless they take care of me like that, right? I can go to Missoula. I can go to Spokane. I happen to have a car that works. We get it. We really get this. And we're going to change that. It's going to take a few weeks
Yep.
to improve it, but we're going to change it. It's critical.
We currently have a committee put in place, just in regards to refills, because it was a great, problem that needed to be tackled. And
Well, you hopped right on it right
Right
away.
away.
That was 2 months ago or something, yeah.
Right,
Yeah.
right, and I mean, but we just developed the committee,
Yeah.
in regards to it, and part of, process and changes is finding out what your current state is. And that's the process that we're in right now. We'll begin to convene and meet and make protocols and, get this running a little bit smoothly. Another thing to be said about electronic health records is we can hit the button and send it, and if it's not working on the other end, and we don't know it's not
All right.
working, we don't know, because
Right.
unless, it sends us back that it failed. But if something's failing on the other end, it shows us on our end, it went,
Went through,
but he never got it.
yeah.
So, the one system we put in place with Kurt is, Kurt, if you have a patient come in, and they said, we sent our prescription and it's been this amount of time, please give the clinic a call while they're there so we can rectify it, because something's not working on one end or the other, and that's part of what happens with an electronic
Yeah.
system,
Yeah.
which is out of everybody's control. It goes
Oh,
off into universal world of nobody knows what the problem is.
It's
So,
locked.
wow.
And we do want to announce, Kirsten, that soon the hospital will be going to the magic electronic record, so be prepared.
December 2nd.
Yeah, so, as all, there's no magic to it.
We brought some benefit to the economy today, I think.
There's lots of people here today.
Lots of people here today.
Training. Other questions or concerns?
I don't have a concern, but I was interested when you said that you needed more assisted living. The original plans were to have another unit across the road.
Oh,
And-
cool.
And that was in the preliminary planning, but of course finances kind of stymied that.
It's almost full. Let's see, it has a, 12-bed capacity, really.
It filled quickly.
Right, and if you have, but I think the license is at 15 bed, I think that's right. And it's set up so that, that you could admit couples in 3 of those
Or
rooms.
3 double rooms.
Cliff told me that they had to have, what's that?
She was the best CEO
Oh,
before, just so you know. Context.
It was built under my watch,
Yeah.
with a lot of trouble.
well, I saw the name over here, a little bit, Madeline Falls.
Oh, I didn't know if you knew.
I assumed that, well, I didn't know which one of you was
You're right.
Madeline.
Well, how many of you knew that it caught fire and burned half down before we got it done?
Oh, really?
Yes.
Yeah, I mean, I don't know that at all.
An old man had a stroke out on the highway and his car ran through the fence
Oh, clear current.
and into the
Wow.
entrance. The building was, well, it wasn't finished yet, and the old car hung up on the cement block that the railing things were on and caught fire.
Wow.
And I got this call about 6 o'clock in the morning, their assisted living is on fire. And oh my God. Fortunately, I had the insurance and everything was all in place, but that assisted living was a struggle. But it filled rather rapidly, and it's been a success, I think, ever since. except the heating.
I left Malta 6 years ago, and at that point we had, I don't know, 8, 12 beds of assisted and 8 independent, and about a 54-bed nursing home, and it was all part of the old nursing home, you know. Since I've left, they've built a 20-bed, I think, I don't know, 18, 20 beds, I'm not sure. It's got a wonderful fireplace in the middle of it. It's a real, and it filled instantly. They built that about 2 years ago, and you know, it's about double the size of what it was. And it's a great transition place. You know.
We had 3 people that moved in the first day.
Mel, and I appreciate you coming to
Right.
this, it's really good. And Lloyd is chairing one of our subcommittees on the board, and we will be recruiting. Our board gets appointed, it's not elected. And so there are very good folks in here, and if you have any interest in being a board member on the clinic board, and your job allows you and all those kinds of things, please let myself know. I'll get that information to the committee on our board as well. We have about, I think at the moment we have 2 openings, and we're always looking for people who use our services. The board of the Community Health Center is a very specific board composition. You must have at least 51% users of your care. And it's one of the, I've served on a lot of boards, it's a very unique board to work with, as is a publicly elected board from the hospital that Larry works with. But, so I'm just encouraging folks, this is kind of a little given Lloyd's talk, recruitment, see what we can get. If you have any interest, you would be, you know, you commit to really understanding and participating at least 2 hours a month at different meetings and really bringing forth the community's concerns and, you know, your own brains to this process, so.
And really, the best thing, we've been consistent, you know, I've met with all of the employee groups, 3 different sessions, met with the county commissioners a couple of times, Cindy has too, our own internal supervisors and the board, of course, and our message has been consistent with all of those sessions is, you know, the biggest way, you know, we have the question come up every time, what can we do to help you? It's to use our services. I mean, that's the, and it's hard when you have some trust issues, you know, but in order to move forward and make sure we do have a hospital and a clinic, you know, down the road, it's just really important we have a few more residents on the assisted side, a few more residents on the long-term care side, and better use of our outpatient services and clinic services, our primary care services. It's just critical right now that we have that. So.
You might want to put that on your website, because when you go on your hospital website, the stuff is really dated, and in this technological universe we live in, people are using that kind of access more and more, and
Just so you know, Jim, we will put that on the list, and because we are deep into the weeds right now, that might not get fixed right away. Just, I don't want to set your expectation. I'm totally with you. We got to get our plan out first in the next month, and
Right.
then all of that will reflect that, we hope. But we're with you on that. I wish I was like a tweeter and all that stuff.
yeah.
Not quite there. Go ahead.
I was thinking about,
Thanks, though.
you know, if people are ginger about, you know, jumping into the water and using the services, I'm thinking about, you know, school starting, sports physicals, and I'm thinking about summer camp getting ready, and then there's a few other sign-offs. There's things related to the winter season. And if you could promote some service utilization in those kinds of discrete areas, you get some put-through of people, and you get some money, and then you get feedback about how is it going.
That's a great idea, and what we're doing right now is flu shots, and that's what we're calling folks about, is
It's
flu
a lot of
shots, yeah.
And
But
we
we're with you.
I was shocked, I got a phone
You
call.
did, oh thank God, Shirley, we got some. There we go.
we actually do
I'm going, what?
I am so glad we got you, and I didn't even know I was gonna put you on my list, and you were gonna get that call tomorrow. I'm happy we got
I'm
you.
ready to go get the shot right now.
Yeah. Anybody who doesn't have one, it's like, I can do for another. Yeah, do a little bit. We do collaborate with the health department once a year. The school physicals are usually towards the end of the school year so that they Regis, Alberton, and Superior, a few nights, we'll stay until 9, 10 o'clock at night and get all the kids done. So that's a service we do put.
How's the clinic in St. Regis?
You really want me to talk about all this right now, don't you?
No, is
In
it
the West
meeting
End.
what you thought? Is it still being served?
Again, we're unwrapping everything, and I'm just gonna tell you that in a county of 4,000, it's very, unique to have so many spots of service. I don't know if we can keep doing that at that rate. Financially, it seems like what we've done is spread ourselves thin, but not really attracted more patients, right?
Okay.
So part of that, you go, hip hip hooray, everyone's healthy, right? Well, in a community that the age is older, probably people aren't coming. So of course, what you all said is we're not doing things right, so we got a lot of things to take care of. Financially, as we untangle this, I'm not sure we can deliver all that we had committed to at all those sites. Maybe. We're not quite clear yet on our current state, but there is a possibility that we're going to have to rearrange what we do at those outreach sites, especially in the short term.
At the HRS Human Resource Council, we actually contributed $75,000 to get that particular clinic off the ground, because as you remember, the bus was going out there, and the nurse practitioner was now the sheriff. But anyway, so we saw the demand for it because it's isolated and it's kind of tough for people to, the winter especially, and if you're poor, it's really tough.
Yeah, we totally understand that. It's just what can we do with what we have, and hopefully we'll have a phase 1, and then if we hit these, then this kind of thing.
And if the clinic and the hospital can't, I mean, we do have a group of nonprofits that are all cobbled together. And I am very
Do
worried
service
about, is it John?
John.
Yeah.
Jim,
Or
John
Jim.
was here.
Thank you, okay. I am very concerned. A lot of my friends don't drive at night.
Yeah.
Or they only drive if their blood sugar is pretty stable. And where I live in Alberton, we have friends helping friends, and people take turns driving places and things. And I know that it's happening throughout the county, but it's not super organized, and I think we're going to have to do. If that was to be taken away, we should. Ethically, we need to have something.
Right. How do we transition that
Yes.
if that becomes the plan? Yeah, I'm hopeful that it won't be total cut off, but I think there's got to be some changes just due to finances. But we will. I don't want that. Everyone marches out and goes, "Oh, they're closing the clinic at St. Regis." Let me say it again.
Yeah.
I am not closing the clinic in St. Regis. We are going to look at it planned.
One example of how we could keep something open but not have it come fully open would be, you can have blood drawn in a place,
Exactly.
but then it is.
Yeah, we talked about that.
tested
Right, we can
elsewhere.
have nurse clinics there. I mean, there's a
Right.
lot of
That's right.
opportunity there.
We've talked about that a couple of times.
Right, that's good.
So just so you know how that really works, the hospital owns that clinic. They own it. At this moment in time, the clinic in Superior is renting that clinic and providing services 4 days a week there. We're paying the hospital rent, because they own that, right? So we're untangling that to make sure that we're doing that properly, that it's not this, that, and the other thing, and who's doing what, and so whatever happens there, right? To the public, you don't need to know that. You don't need to know who owns what and all that, right? You need to know how the service is delivered. But right now, we have to get our handle on the finances so that we can find out, can we pay a provider to be there? Well, we can't if there's only 2 people that come and it's 8 hours of provider time. We can't. Can we do it 3 hours? Maybe, but then we gotta, where does that come from? Do we take it away from here? How does that really work? Because again, 4,000 people in the county. It's beautiful. We live here because it is. It's rural. We know we don't live in Missoula or New York City. We know we're going to have to travel for things. If I happen to get sick, I have to figure out how to do that. Hopefully, I live in a community where I can have that discussion with friends and or family. If social services and faith-based services are there to help me, yay. If they're not, Do I blame them that I don't have those services here? No. I get together with my community and figure it out. But we can't pretend like we have all this money, and thus we can have everything on the face of the earth, right? We just can't do it.
We had a clinic in Alberton at one time, and it was very unsuccessful. Most of those folks down, of course, that was many years ago, and it's a different population now, but
Not much.
most of those people all did their doctoring, they worked in Missoula,
Sure,
and,
Right.
makes sense.
all we got was the druggies that didn't have any money and.
They don't even exist
and-
anymore.
Oh, no. Oh, no. But it was not.
Well, actually, I think that
success.
came up when we were down there. Did you have a mobile clinic?
Well, Alberton,
No,
she was talking about.
I thought about
Oh, I'm
Alberton.
sorry.
Oh,
No.
She said,
oh, Alberton. Oh, I was on the St. Regis side.
Oh, I said Alberton,
Right, yeah.
I'm sorry.
we flipped, we
But in
flipped.
Alberton,
We flipped.
I think we rented space
Oh, okay.
in Alberton.
We heard they also
But
had a
we
mobile
had,
clinic at
at
one
that
time.
time, we didn't have PAs, we had to use an MD, and we had three MDs here. And so we tried it, but it was not successful, and I would doubt that the population has changed that much. It was not successful.
We're happy to stay longer. It's about 6:30. We're happy to stay longer, but we know people probably have other things to do in their lives, so. Again, thanks a million.
Yes, thanks for coming.
Thank you for reaching out. Thanks, really. No, I love being here. That's great.
I think you're trying to get it together.
Now, you still only have one tax ID.
My population and it's less now than it was many years ago when the mill was operating. People are not here anymore. All it is all we are is a bunch of old creepies and a bunch of welfare people. In Mineral County, I'm serious. It's changed from when I was working. It's not here anymore.
Oh, I probably have. I've been around so long, I forget about
I've known him for many years. I worked with him at the border.
until my mother passed away. Right before, a week before. That was the first MHA session that I missed, I think, in 18 years. Maybe used to, 6 or 7. Oh, I remember. Well, it's really great to see you. Thank you. Hey, I left your voice for You're really familiar.
Yes, what I came
What's your name? Just retired.
Now, there's some, you don't.
yeah, well, I need to know, I talked to him once, and then
Maybe not. What is it? Right there, not there, here. Mary Jo has a couple people. Are you with? Oh, great, Shirley. Can I give you one of these?
are you gonna come? Maybe, RSVP, blood drive?
When is that?
Thursday. This Thursday.
What time is it?
You work in the hospital.
That might have been the reception, the way, and I can go all the facts here, so I can't.
Already about 10. Okay.
But there's
What
different.
is locked in?
And I didn't
It doesn't change it.
You will be sitting the
So,
whole time.
you know, patient access will stay less for
We have your registry as they come in, and one person will here with the sign, just making sure everybody's okay. And then we have a high school sophomore for one of her classes, she's coming for 3:30, and your staff's coming. It goes to 5:50, or you can anytime, usually at any time. That's plenty, and you see what you're showing, you go, man, this is crazy. That's great.
Yeah.
Yeah, it is good to get these. Well, thank you. Good. I'm expired.
Oh, yeah.
Thursday, 1 o'clock here.
That's right.
No, I'll be here. With my badge. No. Yes, I do.
Otherwise it's cast. Okay. Wonderful. And the room's open, sitting room said it's open, so just go in.
You know, and
I know.
10 MRHC, yeah.
Well, I do have a real passion for small hospitals.
or give them a shot. Or,
You wouldn't have a hospital if you haven't left.
I have another question. One time.
Right.
so in all scenarios, I would like to say they wouldn't have prescribed to you that and you got your paper for sending that.
Oh, some of my benefits, yeah.
Credibility problem. Yeah, not good. I would have been too, as a taxpayer. Well, thanks for coming. Thank you very much. Does Madeline live here in Superior? I didn't know that. I do remember her.
Yeah, well,
All right.
you know, it's enrolling in the hospital, I do payroll for the hospital.
Was the old hospital probably, direct department?
You know, that's,
I do payroll, and every month. And then I was there, so you're a member, you know.
so they're gonna spend it now, because that's what they
Funding,
do,
you know,
that's what they do.
I was there from the beginning, and now I'm working in the
Oh, she,
for quite a few years.
before she became.
Yes, well, you know, county there again.
Our network is down, so I had down and,
That's all there was.
you know, because I got
Dude, that was just high. I mean, I don't know if they pay all salaries.
Why is it?
Well,
Especially when you're ready.
oh,
Of course, you know, the computers and all of that, savings money, it actually costs us money.
You don't register as a
Yeah,
party.
we, we couldn't.
Facebook, instead of getting the building straightened out over there. I mean, I'm speaking.
Are you talking about?
Clinic billing. I mean, that is. Over a year, I mean, it was even in the newspaper for 3 weeks, you know. You know that they're going back to September of 2012, and I'm reading this in the local paper, and I'm going, well, I know that was my settlement, or Medicare. You don't get it, SOL. That's your SOL. And I'm speaking to my son. He has a shoe and that was a mess for a long, long time. And he finally just paid $200, $20 copay. Okay, he paid it. He's still getting bills. Call down there, talk to her. I don't know where it went. I mean, he has paid me back. I don't know where it went. In the beginning, it was $100. And now it's $80.
Well, at least it's down.
Hey Shirley, thank you.
Thank you. Oh, are you gonna take this one down?
This is me. I don't think so. I think that's what I got to in town with.
Oh,
You know, and if you
okay.
ever
Is it the same guys? Yeah. You have it. You're in trouble,
Yes.
In billing or,
No. She worked in the, oh my God, it was over nurses too.
oh, assisted living or long-term care.
Nursing home. I went, I also worked in physical therapy.
Oh.
Was a nurse.
I'm first a nurse.
Oh, you're a psych.
I have a bachelor's in, yes.
Oh, yeah, you,
I drive out to St. Regis.
you're just almost like an awesome.
Well,
I have lots of those.
yeah, we,
Things and dropping them off.
well, the auditors actually, they're doing the annual audits.
Yeah, well, I got those every year too. And when you have grants, you know,
With,
you know, you're on the hospital part. Like I said, I just did one of these. And have that for Tea party, if someone wants to, they're
Right.
representing us, the taxpayers.
right, that's correct.
My family originally
Um,
was.
There's a chunk of board